Bringing a new life into the world is one of the most personal moments you'll ever experience. And at Penn State Health St. Joseph Medical Center, you're supported every step of the way. From beautifully renovated birthing suites and a compassionate family-centered team to advanced technology designed with both mom and baby in mind. Every detail is built around your experience. But the care doesn't stop there. With the expansion of pediatric services, including pediatric surgery now available close to home, families have access to expert care when it matters most. And through a powerful connection to Penn State Health Golisano Children's Hospital in Hershey, your child is backed by a full network of specialized pediatric care, from routine needs to the most complex conditions, from birth through every stage of childhood. Everything your child needs is right here. It's all ahead on Your Health Matters, because when it comes to your growing family, your health truly matters. At Penn State Health St. Joseph Medical Center, our state-of-the-art birthing center is designed with both baby and parent at the heart of every moment. Blending advanced medical care with a warm, home-like environment, it features personalized birthing suites, holistic support, and a compassionate team dedicated to caring for your growing family. From prenatal care through postpartum support, every detail is thoughtfully designed for comfort, safety, and peace of mind. A true commitment to healthy beginnings and the families we serve. Good evening, I'm Liz Kepner. Tonight we're taking you inside Penn State Health St. Joseph Medical Center to show how care is evolving for families right here in our community. We'll take you on a tour of the newly renovated birthing center designed with moms in mind and explore the expansion of pediatric surgery that's bringing specialized care closer to home. This is about access, comfort, and confidence when it matters most. You will hear from a local mom who experienced the difference firsthand, meet the care team supporting patients every step of the way, and learn how Penn State Health St. Joseph Medical Center works closely with Penn State Health Golisano Children's Hospital in Hershey. Plus, we'll take a closer look at the latest breakthroughs in pediatric cancer care and the hope they're bringing to families across the region. Because at Penn State Health, breakthrough medicine lives here. And with that, let's send things over to Christina to get things started. Hi, Christina.
Hi, Liz. This new birthing center is a modern, compassionate approach to childbirth. It's one that blends clinical excellence with the warmth of home.
Hi, everyone. Welcome to the Family Birthing Center here at Penn State Health St. Joseph's. Come with us on our newly renovated unit for a tour.
Come with us while we show you one of our newly renovated rooms and surprise you with all the homey feeling that you'll get when you come here.
So to start, each one of our labor rooms has a beautifully designed labor bed. This has the capability to be able to be put in all different positions, optimal for mom's deliveries, however they desire to deliver, and for the safest possible delivery.
So we were able to update this cabinet area over here, which provides the families with storage space for their belongings, as well as our new couches. We were able to get these new couches, which also have the capability that they can kick their feet up and relax while they're here. It's really important that the support people and the family are also comfortable during their stay, not just the patient. And then they're able to have their meals here as well. Then the table would go down and then the back comes up and turns into a bed for the loved one as well, so that they can be comfortable while they're here.
We have these care boards now also. This helps keep the patient and family a part of the care team, so they know who's taking care of them, things that need to be done before their discharge. We keep them updated on their pain goals, their progress through labor, and anything that they want, because we want to keep them a part of the collaboration.
This is what we use here so that we can do all of our assessments, baby's first baths. We promote rooming in here. We're a baby-friendly hospital, so it's really important that the babies are in the room with the parents so that they can learn their feeding cues and things like that. So the baby doesn't leave the room. Everything can be done mostly right here.
The other amazing thing that we have here at the birthing center is these are the state-of-the-art cribs for all of our babies in order to promote safe sleep with all of our families. These beds are able to turn every which way in order for families to be able to sleep close to their baby while promoting safe sleep at the same time. They also have the capability to be able to go up and down as well in order to adjust to the bed height for mom in order to keep mom safe then as well. Our patients mean the world to us here in the birthing center. Every patient that comes on the floor is everyone's patient. We all work as a team here. So we don't just stick to our individualized patient or your assignment that day. So us being here at this centralized nursing station, we're all able to watch every labor patient who's here on the monitor. We're all able to see the call bell system and all be able to have access to maintain good teamwork for safe deliveries.
And then we also have a new triage area that got an update, and we have a warm welcome desk. So when people come down the hallway, it's just a warm, welcoming feeling for them.
Centering is a program where I say you're in like a group. It's group prenatal care, but you're in with a group of other women who are all due around the same time you are. It's a program where we offer wonderful education and support on various topics, whether that be from breastfeeding to relationships, labor and delivery, the tour. You just get such a well-rounded program and feel really grounded and supported for your next step in your journey on parenthood. And if anyone was thinking about doing centering, just try one. Just try one class and you'll see that we are home, we are family, and we welcome everybody.
So here we have our donor wall, the Brightigan family, one of our biggest donors. It's named after. It shows our legacy and the people that contributed to this entire unit.
Lactation support is very, very important for mom right from the beginning. So we start off at our facility. We are a baby-friendly hospital, so we provide a network for moms from prenatal all the way through until mom is discharged from the hospital. And then we continue to support mom and make sure that they're having good breastfeeding success. They do enjoy coming to our baby bistro, which is our lactation support group that we offer 3 times per month. This is a free support group and the mothers enjoy it, enjoy the company of other moms, their support, as well as the support of the lactation team. And for baby, there's many, many benefits. Baby gets the first immunologic boost. It keeps baby healthy. The reduced risk of sudden infant death syndrome, childhood obesity, heart disease, diabetes. The list is endless.
And that really, I have found, helps our moms do better. Even if I see you 2 or 3 times in the postpartum period, that's what it's all about. And I always said, while I want a healthy pregnancy and I want a healthy baby, I want a healthy mom too.
I just can't say enough about this facility. The staff is wonderful, the physicians are wonderful, the midwives are wonderful. Everybody's lovely, pleasant, happy. We're always here to help you.
Thank you for coming with us on our tour of our new unit. We hope to see you soon.
As you can see, the new birthing center is more than a place to give birth. It really is a space filled with warmth, comfort, and the kind of genuine, compassionate energy our team brings to every family they care for. Liz, back to you.
Thanks, Christina. We met up with a mom of 4 who gave birth to 2 of her little ones before the birthing center renovation. After its completion, she came back to test out the new center with the birth of her twins. Here's what she had to say about her experience.
We're joined now by mom Marissa Hahn-Vanks, who had her twins at this beautiful new Penn State Health St. Joseph's Birthing Center. Marissa, you have 4 boys. You look incredible. Take us back to those, first deliveries before the renovation. What was your experience like then?
Thank you so much for having me today. I'm so excited to speak about this experience. I had my first son in March 2017 on St. Patrick's Day, and my second son was August 2019. So I've experienced St. Joe's in all of its different ways. We had a wonderful experience during those times. Definitely could see the brighter rooms and meeting the new teams when I recently had my twins in October.
So now that you've experienced the newly renovated birthing center, what was your reaction when you walked into the new space?
The first thing I noticed is it's much brighter. And I know that might sound like a simple detail, but I think as moms walking in, we've got so much on our minds, having a new baby, just feeling like we're in this bright, clean, exciting, fresh space really makes a difference in the environment.
So for the moms who haven't seen it yet, how would you describe the environment? You made it seem so bright and cheery. What makes it feel different from a typical hospital setting?
We felt like everybody there was just so excited to be a part of our experience. We felt like everybody cared about my husband and myself, and even asking about our boys at home as we were preparing to have our twins. There was just this general enthusiasm, and everybody was so excited for us that it made the whole experience really wonderful.
You mentioned that you would move in there if you could, and that says, a lot. What makes you feel that comfortable and cared for during your stay?
When I had my first 2 boys, being a newer mom, I felt that way because everybody was just so supportive and teaching me so much, and I remember my husband even joked with one of the nurses, "So, can we take you home with us? Because 'Cause we're going home with this new baby, and what are we supposed to do next?" But they taught us so much while we were there, and then recently with having the twins, that everybody was just so incredibly supportive, especially knowing that I had 2, and that was, a brand new aspect for me with having 2 babies at once. There was even a moment that they were like, "We can just, we'll keep an eye on the babies. Why don't you just go take a shower or rest or something?" And the way they go above and beyond to really make sure that you're okay, never feel like you're a burden when you're asking for their help, really meant a lot to me through the experience.
You also got to experience the Baby Bistro program. What stood out about that, and how did it add to your overall experience as a mom?
Yes, when I was a first-time mom, Baby Bistro was the only place that I was comfortable taking my baby at first. So that was really my practice of packing up the diaper bag, getting in the car, driving somewhere, getting out of the house. But that comfort level that I had with St. Joe's and knowing that I could go back, it felt like home to me, coming and connecting with all the other mothers, learning different things about having a newborn and feeding. At the time, there was a lactation consultant I really connected with who helped me through some of the challenging times, and it really developed the bond that I have with my children today because St. Joe's is very much about skin to skin and the parent involvement and that golden hour or two after the baby's born, making sure you have that bonding time. All of that really taught us a lot about making sure that we prioritize that time with our children. And I feel that that started the bond that I have with my 4 boys today.
If a mom is trying to, figure out where she's going to deliver, what would you tell her about choosing Penn State Health St. Joseph's Birthing Center?
I would say going in there, you know that you will be cared for from start to finish. I also have to mention throughout the entire pregnancy, they were very supportive of me, especially being twins, explaining all the possibilities of being a higher risk pregnancy. Everybody was literally and figuratively cheering me on the entire time. I still remember when I was having the twins, I could hear the nurses in the background saying, "You got this, mama, you can do this." And it was just, I'm getting choked up thinking about it, but it meant so much to me. And I'll always remember that experience, and it meant the world to have that positivity as the babies entered the world.
Oh, Marissa, that's such a great experience and so amazing. Thank you so much for joining us.
Thank you for having me.
We're so happy Marissa is doing so well, and we're so grateful for the kind praise on the new birthing center. We're going to take a quick break, but we'll be right back with the latest in pediatric surgery and cancer care. Stay with us. Welcome back to our special Your Health Matters. I'm Liz Kepner. We're here tonight to bring you the latest news on Penn State Health St. Joseph Medical Center's new birthing center, which is very exciting. And joining us now to do that is Stacy Border, Director of Women and Children's Services, and Andrea Berkeley, labor and delivery nurse, both with Penn State Health St. Joseph. We're so happy to have you guys here. You saw that story about Marissa. Let's start with the big picture, Stacy. What inspired the renovation of the birthing center, and what was the most important thing as you reimagine the space?
So we were fortunate to get a grant from Congressman Muser, and we wanted to make sure that that money was used and touched every space in the birthing center. We wanted it to feel like home for our moms and have a bright, cheery space for them.
Andrea, you're right there with the moms every day. And what was your reaction when you first saw the new space? Because I saw you watching the video. You were really enjoying it. How has it changed the experience for the patients?
Honestly, I was in awe when I saw it for the first time. This has been quite a few years of planning. It's been about 3 years of planning. So what was amazing was that us as the nursing staff were incorporated as well with the plans as well. So it just is a brand new welcoming space for our moms to be able to have an amazing and safe birthing experience.
So for families that are walking in for the first time, Stacy, how would you describe, the new birthing center experience compared to what it was before?
home, warm, welcoming. When you enter our space now, you enter into a welcome desk where you're then guided to where you need to go. So you just don't feel like you're walking down a long hallway.
Right. And Andrea, it's a special moment for families. How does the new environment, help you support moms, not just physically, but emotionally as well?
So I take care of all of my patients like I'm taking care of a family member. That's the type of nurse I am. That's the type of team that we are at St. Joe's. And so having the new space, the welcoming walls of the beautiful individualized murals in each room, the colors, the open space to be able to sit as your care team, actually sit and have a conversation to be able to individualize care is so special and something unremarkable, honestly.
There's a real focus on comfort, as we've been talking about, personalization. What are some of the standout features, Stacy?
The whirlpool tubs that the moms can labor in, having that private space where they can stay in their room, they can labor, they can deliver, and then stay in there postpartum. And then having that area that they can have their family come in and join them with them.
Okay. And Andrea, we know support doesn't stop after delivery. Can you talk about some of the care that the moms receive after the birth and then the resources available so that they're comfortable and confident going home?
Absolutely. So us as nurses, we're also educators from the time of admission to beyond discharge, like you said. So we provide them with lots of education from beginning to end, and we also provide written materials. So in case you can't remember things that we're saying, we provide everything to you in a book with QR codes to be able to access links, and we also are all just a message away. We provide our work emails to be able for people to feel supported at all times.
You guys are amazing. I know the nurses, you guys do the work. I appreciate it. Stacy Border, Director of Women and Children's Services, Andrea Berkeley, Labor and Delivery Nurse. Again, thank you both for joining us tonight.
Thank you.
And now we're going to take a look at the latest in pediatric surgery at Penn State Health. And to do that, we're going to send things back over to Christina.
Hi again, Liz. I am joined now by Adi Fahy, pediatric surgeon at Penn State Health. Thank you for joining us. And we want to make sure that folks at home know pediatric surgery is now available right here at Penn State Health St. Joseph Medical Center. What does that mean for families in this community?
Absolutely. Thank you, Christina. So we know that pediatric surgery is scary. Having your child or your family member go through surgery can be very scary for the child, for the parents, for the siblings. And so the more that we can do as pediatric surgeons to make that experience comfortable, accessible, close to home, the better.
And you said it, pediatric surgery can be scary. So why is it so important to have these services close to home?
So we know that children do best when they're closer to home, when they feel very supported, when parents can visit, when parents can be there, and people aren't needing to take a lot of time off work and off school to make long journeys. We've been offering preoperative and postoperative care in the Reading area for quite a while now, but we were so excited to have the opportunity to start to offer some surgeries here at St. Joe's. And it's our 7 pediatric surgeons who are based usually at the Hershey Center who are coming out and offering very expert pediatric surgical care in a setting that can be close to home.
Sure, and you're connected, as you said, to Penn State Health Golisano Children's Hospital in Hershey. How does that relationship benefit patients who are being treated here?
So I think what's wonderful about it is that you can access care very close to where you live, but then you also have incredibly subspecialized and deeply focused providers who can be based in Hershey and be able to come out here, or equally to work in a multidisciplinary fashion there to really optimize care for your child.
Okay, and what are some of the more common procedures or conditions that you're able to treat now?
So what we've started kind of offering surgically wise at St. Joe's are things like belly button hernias or umbilical hernias. Inguinal hernias or groin hernias are very common in young children, and those are one of the things that we now offer here. Again, kind of sparing the journey, little small lumps and bumps that need to be removed, as well as sometimes if you have appendicitis and we're able to coordinate it with our operative days, then we would be able to take care of that emergent set in that kind of easier setting for you.
Sure. What a gift to this community to have this all right here. Adi Fahy, pediatric surgeon with Penn State Health. Thanks for joining us. We'll see you again in a bit. And for now, we will send things back to Liz.
Thanks, Christina. Coming up, we'll talk about how Penn State Health St. Joseph Medical Center is leading the charge when it comes to advanced treatment for pediatric cancer. Stay with us. Welcome back to our special Your Health Matters. I'm Liz Kepner. Treating pediatric cancer takes both precision and deep compassion, combining advanced targeted therapies with care that supports the whole child and the entire family. We connected with Dr. Giselle Scholler to share the latest innovations in childhood cancer treatment. Let's take a look.
Joining us now is Dr. Giselle Scholler, Division Chief of Pediatric Hematology and Oncology at Penn State Health Golisano Children's Hospital. Dr. Scholler, thank you so much for joining us. And childhood cancer treatment has changed dramatically over the years. How is that progress showing up in the care you're able to provide here at Penn State Health Golisano Children's Hospital?
Our division is built upon exceptional clinical care, groundbreaking preclinical research brought together through a translational research program to deliver our new therapies, new discoveries directly to our patients. Through the research happening here, we have now 12 early phase clinical trials with novel medications that are bringing hope to our patients, with a real focus on both precision medicine and immunotherapy.
Some of the research that's happening today would have felt, unimaginable a decade ago. How is precision medicine changing the way that you treat children with cancer right now?
The field is moving very quickly with the ability to perform genomic sequencing on our patients' tumors and blood. Very quickly now opens doors for personalized medicine, for liquid biopsies, for precision immunotherapy, and cancer vaccines. For all children, regardless of diagnosis, we've developed a comprehensive precision medicine program here at Penn State. Today, this is standard of care. Every child at Golisano Children's Hospital undergoes tumor sequencing to clarify their diagnosis, identify any targetable mutations. We collect liquid biopsies every few months to monitor minimal residual disease and detect changes in tumor mutations and watch for early signs of relapse. We recently published one of our cases, a young girl with osteosarcoma who experienced multiple relapses and was considered incurable, but responded to therapy directed by our precision medicine approach. And she is now 5 years cancer-free. It's very exciting.
That's amazing. One of the most exciting breakthroughs is the development of vaccines that are created from a child's own tumor to help their immune system fight the cancer. How does that work, and why is that such a promising step forward?
Yes, today training the immune system to fight your own cancer is a goal that many are working towards. Here, we are conducting a clinical trial where we are creating personalized vaccines and activated T cells, which means we're training a patient's own immune system to recognize and fight their cancer.
That's incredible. Much of the innovation is happening through your work at Penn State College of Medicine. What other areas of pediatric cancer research are you most excited about right now?
So research in labs across Penn State are developing new therapies for pediatric cancers. We have novel trials right now for solid tumors and brain tumors. One of the drugs here that was developed here that I'm really excited about is a new medication called GB13. This is going to be a first in human clinical trial for an incurable brainstem tumor called DIPG. It's one of the most challenging cancers that we have in pediatric oncology. So we're right now with the FDA, and our goal is to have this trial open by the end of the year. But I'm very excited about the hope that it's going to bring for these families.
My goodness. And as families, students, and communities continue to rally behind, Penn State's Thon and Four Diamonds, how is that support directly helping move the research forward? And what does it do to, make possible that wouldn't happen otherwise?
It's incredibly important for the research. Really, none of these trials would happen without the support from Thon and Four Diamonds. Because of this funding, we're also able to have an integrative medicine program that offers naturopathic support, massage, acupressure, aromatherapy, really things to help our children thrive while they're on the cancer journey. We also are fortunate to have our one program, which is oncology, nutrition, and exercise. Nutrition and exercise have shown to be very important to provide best outcomes for children with cancer. So we're really thankful to have this entire integrated program here at Penn State.
That's wonderful. And finally, when you look at how far we've come and what's ahead, what gives you the most hope for children and families facing a cancer diagnosis?
I believe the future for children and cancer lies in the discoveries today as we focus on personalizing care, moving away from the older toxic chemotherapy to more cancer-targeted medications, engaging the immune system, incorporating the supportive care and integrative medicines that we've talked about, exercise, nutrition, to allow our patients the hope of a healthier future after their cancer journeys are completed.
Dr. Giselle Scholler, thank you so much for joining us.
Thank you.
Through ongoing research and personalized treatment plans, pediatric cancer care continues to improve outcomes while prioritizing quality of life for both children and their families. Now we're going to send things back to Christina to talk more about pediatric surgery. Christina?
Hi again, Liz, and I am once again joined by Dr. Adi Fahi, pediatric surgeon with Penn State Health. Thanks for sticking around. And you are not only performing pediatric surgery here locally, but you're also highly specialized, and you work closely with the pediatric cancer team, including Dr. Scholler, who we just heard from at Penn State Health Golisano Children's Hospital. Talk about an incredible level of expertise these families have access to.
Absolutely. It's a real privilege and wonderful to be part of such a skillful team, and we do everything we can to work in a very close multidisciplinary fashion with them. Taking care of kids with cancer is one of my strong passions, and the more that I can do to make this incredibly challenging experience as smooth and as easy as possible for these patients and their families, it continues to bring us fulfillment every day.
Wow, and of course, the hope is we can prevent some of those unnecessary surgeries. Let's do that by talking about prevention right now. And we keep hearing more and more about these water beads that kids play with. They're fun for them, but what are the risks with them?
So the risks for water beads really applies to the children who are of an age where they'll just put anything in their mouth. And so particularly for those, once the water bead is in their mouth and they've swallowed it, it starts to absorb water and get bigger and bigger. And unfortunately, these can cause bowel obstructions and need multiple abdominal surgeries to get a patient kind of home safely after that. And so really kind of trying to keep them away from those younger children and helping to supervise them play safely, I think, is really important.
And another thing that is around so many households, but also very dangerous, and we keep hearing about, are those button batteries. What about them is so dangerous, and why is it considered such an emergency?
So again, for a similar age group of children, button batteries are something that they'll swallow out of sheer curiosity, and oftentimes they get stuck in the esophagus or the swallowing tube. And unfortunately, they can cause really severe burns, and burns that can even cause it to perforate or pop a hole in that or erode into blood vessels and cause devastating kind of side effects. And so what I would suggest is, never keeping loose button batteries at home, making sure that children don't have access to things that are easy to get the button batteries out of, supervising the children if you know that there's button batteries close by, and then if you have any concerns that your child might have swallowed one, even if you're not sure, just bring them straight to the local emergency department.
Okay, all right. Dr. Adi Fahi, such a gift to our community. Thank you for joining us tonight. Thank you. And Liz, we will send it back to you.
All right, thank you, Christina. That wraps up your Health Matters special. As always, you can find the latest information on our website. We also want to remind you that if you'd like to tour the new birthing center at Penn State Health St. Joseph's Medical Center, just call the number on your screen. Because at Penn State Health St. Joseph Medical Center, your health matters. Good night.